Hi, I'm Christine with Torrance CitiCABLE, and today I want to introduce you to some of our local heroes who have been working around the clock during this pandemic.
It's no longer, am I going to see a COVID patient today? It's, I'm going to see all my COVID patients today, and then I'm going to see my regular patients, and then I'm going to go to the next hospital and see all my COVID patients and my regular patients, and it's become sort of just part of what we do now.
Dr. Anita Surkar works 12 to 14-hour shifts 12 days in a row, taking just 4 days off every month. She's been on this schedule for more than half a year now.
It's sort of lonely because I don't have much of a life outside of the hospital, but the work that we're doing here is so important that I almost forget that there is life outside of what we're doing here.
Dr. Surkar says she moved out of her home because she didn't want to put her mom at risk for COVID-19. After 15 years of working as a doctor, 10 of those as an infectious disease physician, she says she's never seen anything like this.
This has been a year like no other year before. It has tested me on all kinds of levels, and I don't think it's just me.
To help capture what frontline workers are really experiencing, South Bay resident Mauricio Villalobos reached out to Providence Little Company of Mary, offering to take headshots of healthcare workers wearing a mask and sharing their personal stories. You can read each story on Villalobos' Instagram page at eyes.of.today.
So the idea was to ask people how this pandemic affected them, but also what they learned positively from it.
9 healthcare professionals participated in this project, and their portraits and their words hang prominently inside the hospital's cafeteria.
I wanted to make it perfect. I wanted to make sure that the idea, when people see these photos, that it was going to be embracing, it was going to be show the resilience of the people that is living through these times, especially the healthcare workers.
Putting together this exhibit called Eyes of Today was an eye-opening experience for Villalobos, who struggled for months when his work as a camera operator for the film and music industries vanished due to the pandemic.
I hit rock bottom because I have money that I need to pay, I have rent, I have all these things, I maintain my mother. It really hit me, so I was very depressed. But when you have so much time in your hands and you can do two things. You can you can get depressed and get lower, or you can do the best you can, and that's what I try to do.
He says giving back to his community in this unique way also taught him some priceless life lessons.
Appreciation of the present moment, appreciation of the little things in life, because just like we know now, things can just disappear. Believing in yourself and believing in an idea and going with it regardless of what other people think, or even second guessing yourself. So to me, it showed me that if you really care and if you really want to make things better, you can.
Dr. Surkar's portrait is among those that are featured.
There's a trepidation in my eyes, there's fatigue in my eyes, but I think there's also this determination that we will get through this.
She says seeing pictures of her colleagues next to hers helps her to feel like she's not alone. She thanks Villalobos for giving her a chance to sit down and reflect on the work she's been doing. And she hopes these faces and their stories help the audience to better understand what it's like to be a frontline worker today.
Even on the days that were devastating, where you're just flattened because you put everything you could to get that patient back and you didn't win that one, you take it a moment and sit with that grief, and then you wake up the next day and say, hey, what am I going to do different? What can I do for the next one? Because I'm just coming to work every day to save as many as I can. We've tested between both campuses, Providence here in Torrance and in San Pedro, over 16,000 people, and we've had over 1,000 admissions and over 850 discharges, meaning patients that came in, they were COVID positive, either they were very sick and they were on a breathing machine in the ICU, or they were on considerable amounts of oxygen, and we were able to successfully discharge them home.
Dr. Surkar plans to spend the holidays working at the hospital and says seeing thank you notes like these really brighten her day.
Totally does, especially the ones from the children where they draw us, superheroes, or their spelling is incorrect. It's really endearing.
She says keep them coming because that's the best way to show how Torrance cares.
Try not to let me see you in the hospital. So that would be the greatest support that you could give me, is to not end up, in the ER. Keep wearing a mask, social distancing, try to keep your family gatherings small or none at all. It's the small sacrifices that you make this year that will ensure that your loved ones will be with you next year, hopefully, when we're able to celebrate together.
In Torrance, I'm Christine Lee.